Hello everyone, I'm Dr. Sagar Bhargava. So in this video, we will see patients who have decided to undergo cataract surgery, what all things they should keep in mind before they actually do the procedure. So here is the checklist of the things that everybody should know in their preparation towards cataract surgery. So the first thing that is very critical for your outcome and your mental satisfaction is finalizing the lens type. Now, before we dwell into this, the your surgeon's assessment of your eye is critical. If you have certain diseases like glaucoma or iritis, then the doctor himself will take a call as to which lens is suitable for you. But if you have no ocular conditions or no eye disease, then you have a big say in deciding what type of lens you can avail. And this decision becomes simple if you can figure out which condition suits you the best. So following are the three conditions that one has to take a call on. So these conditions include: I want to be free of glasses to the extent possible. I don't mind wearing my glasses for distance. I don't mind wearing my glasses for near. So the next thing that you should consider is this. Now I don't want to wear glasses at all, and I can tolerate minor side effects of the lens. And I'm willing to adjust with decrease in quality of vision. In this scenario, the best lens for me would be either trifocal, multifocal, or a EDOF lens. The details of these lenses are covered in my other videos, which is available on YouTube. But if you are not very keen on spectacle independence, also cannot tolerate minor side effects of the IOL, and are not willing to compromise with the quality of vision, then the best lens for you would be monofocal. Now, in monofocal, you would need to understand two more points. How much is your low light activity? And post cataract surgery, what kind of spectacle freedom are you looking at? Is it for near you want to be spectacle free, or for distance you want to be spectacle free? Once you give these two information to your surgeon, he will then take a call as to which monofocal is suitable for you. The different categories includes aspheric, non-aspheric, toric, and non-toric. If you go for the first option, where you are finalize trifocals, multifocals, and EDOF lenses, you would need some additional tests, and these tests include repetition of your biometry, then special study of your cornea called as tomography, and a retinal scan called as OCT. All these tests are required so that the predictability of these lenses can be enhanced to the maximum. Next, we move on to general health assessment. Now, any patient who undergoes cataract surgery has to do some basic tests. For example, standard blood tests like blood sugar levels, hemoglobin, has to undergo an ECG and a physician evaluation. Now, physician evaluation is a very important part of pre-cataract workup, and physician will essentially look into presence of any infection in the body, be it dental infection, throat infection, skin, sinus, etc. And he has to make sure that these infections are treated before the patient is undertaken for cataract surgery. A diabetic patient should have a very good control of blood sugar levels. For cataract surgery, blood sugar levels of less than 200 are acceptable. And a hypertensive patient should obviously have a good blood pressure control, because a very high blood pressure on table can have its own problems. And as far as the heart condition is concerned, it should be stable. Now, a lot of people have ongoing oral medications, and common questions that are asked is whether these medications need to be stopped. Now, one of the most common groups of medications are blood thinners like aspirin and clopidogrel. In routine cataract surgeries, the risk of hemorrhage is very, very low. So these blood thinners actually don't have to be stopped. They can continue as routine. But if you have potent blood thinners like warfarin, they need to be stopped preoperatively and substituted by injection heparin. Other oral medications can go on as usual. Now, what do you do if you suffer from claustrophobia? What is claustrophobia? Claustrophobia is a condition where a patient has a fear of closed spaces, and patients get a feeling of intense suffocation. Now, in cataract surgery, when we take the patient up for surgery, their eye and face is covered by a drape. So at that point, if the patient is very claustrophobic, he might get an intense feeling of suffocation and will not be really able to continue with the surgery. Now, in this situation, you should inform this point to your surgeon beforehand. The question would then remain is how severe is your claustrophobia? And one of the ways to detect that is to do a dry run or a trial run of surgery and do a simulation of OT preparation in such a way that patients get a good feel as to what will happen during the eye surgery. So if the patient is able to withstand that trial run, then you can very well take up this patient for surgery. But if the patient has acute issues while doing that trial run, then obviously the patient has to be taken under general anesthesia. Now, preparation of general anesthesia is important, and a pre-op anesthetic checkup is required. This is done by the anesthetist, and certain investigations may be additionally advised by anesthetist, for example, X-ray chest. And once the date is finalized, when you come for the surgery, you have to be empty stomach for 6 hours and no fluids for 2 hours just before the procedure. Very important point is preoperative eye drops, which are antibiotic eye drops, should be started 1 day prior to the date of surgery. If you miss that, there is a high chance that the surgery will get cancelled. On the day of surgery, you need to take a normal bath, apply the antibiotic eye drops at least 2 times in the morning. For a pupil patient, we advise to avoid eye makeup and wearing of ornaments. In case you are using hearing aids, that can be allowed in the OT for a better coordination. Thus, knowing all these points will, before the cataract surgery, not only will lead to better outcomes, but will also reduce chances of complication. I hope this small video sharing with you the things that you should know before undergoing cataract surgery will be of help for people who are planning for undergoing cataract surgery in future. Thank you so much.